Let's be real, if you felt completely lost trying to figure out acne, you are so not alone. It feels like there's a million different opinions out there. So in this explainer, we're going to cut right through all that noise. We're going to build a clear, science-based guide so you can finally understand what's going on and how to treat it. Let's dive in.
So why is it so frustrating? I mean, it's because there's just so much conflicting information everywhere you look, right? You've got social media trends, advice from friends, and it can feel like you're trying every single thing and getting absolutely nowhere. Our goal here is to give you a solid foundation based on what medical science actually says.
Okay, so to start, we have to get the definition right. Because, understanding what acne truly is from a medical point of view, well, that's the very first step to treating it the right way. The official medical name is acne vulgaris. And I want you to notice that word, disease. That's a huge point. It's a recognized medical condition. And that other fancy term, pilosebaceous unit, it's just the technical name for a hair follicle and the little oil gland that's attached to it. So this tells us right off the bat that acne isn't just some surface-level thing. It's a complex condition happening way deeper inside our skin.
All right, now we are at the absolute core of this explainer. Almost all acne, no matter what it looks like, comes down to a combination of 4 key things happening inside one tiny pore. And I promise, if you can get your head around these 4 steps, you'll understand exactly what every single acne treatment is trying to accomplish.
First up, we've got too much oil, which is medically known as sebum. So think of certain hormones, especially androgens, as little messengers that run up to our oil glands and basically yell, "Go into overdrive!" This floods the pore with oil, and that creates the perfect starting environment for a breakout.
Second, we get a clog. Normally, the skin cells inside our pores shed nice and neat and just clear out. But sometimes they get all sticky and they start to build up, creating a plug. The best way to think of it is like a traffic jam right at the exit of the pore. Now, all that oil we just talked about, it's trapped inside with nowhere to go.
So now we've got a clogged pore that's just full of trapped oil. Well, this creates the perfect breeding ground, a literal feast for a specific type of bacteria that normally just chills on our skin. It's called C. acnes. With this endless buffet of oil, this bacteria starts to multiply like crazy.
And this brings us to the final and most visible step, inflammation. Your body's immune system sees this clogged pore and all this bacteria having a party, and it sees it as a threat. So it launches an attack. It sends in inflammatory cells to fight it off. And that battle is what we see and feel as the redness, the swelling, and the pain of a pimple.
Now, those 4 root causes, they don't just happen in a vacuum. There are other things that can definitely play a role. For instance, genetics might mean you're just predisposed to oily skin. Hormonal shifts during puberty or your monthly cycle can totally ramp up oil production. And yeah, even things like stress or a diet high in sugar can, for some people, act like amplifiers, basically pouring gasoline on the fire. But just remember, they're usually making one of those 4 core problems even worse.
Okay, so now that we know the why, let's look at the result. Not all breakouts are the same, and figuring out which type you have is absolutely critical. Why? Because you just don't treat a simple blackhead the same way you treat a deep, painful cyst.
At the highest level, we can really split acne into 2 main camps. You've got non-inflammatory acne, which is mostly just about the clog itself, those first 2 root causes we talked about. Then you've got inflammatory acne, and that's what happens when the immune system gets involved and brings on all that redness and swelling.
This little table breaks it all down. We start with the non-inflammatory stuff like blackheads and whiteheads, which are really just different kinds of clogs. But as the immune system gets more involved and that inflammation ramps up, those clogs can turn into papules. Those are the red tender bumps, and pustules, which are the ones with visible pus. And then at the most severe end of the spectrum, you get nodules and cysts, which are deep, really painful, and unfortunately carry a high risk of scarring.
All right, enough about the problems, let's talk solutions. The really great news is that dermatologists follow a very logical, evidence-based approach to this. I like to think of it as a treatment ladder. You start on the first rung, and you only climb higher if your acne doesn't respond.
This right here is the single most important rule of acne treatment. There is no magic bullet. A single miracle product simply doesn't exist. The right strategy has to be, and I mean must be, tailored to the specific type and the severity of the acne you're dealing with.
So here's how that ladder actually works. For mild acne, we're talking mostly blackheads and whiteheads, you'd start with topical treatments, like retinoids or salicylic acid. For more moderate acne that has some inflammation, you'll probably use a combination, often a retinoid plus an antimicrobial like benzoyl peroxide. For more stubborn cases, a doctor might add short-term oral antibiotics.
And for the most severe, scarring acne, the gold standard treatment is still oral isotretinoin.
Okay, this is a huge one. A critical warning you'll hear from every single dermatologist. Never ever use a topical antibiotic by itself. Why? Because doing that can basically teach the acne bacteria on your skin how to resist the drug, making it totally useless over time. That's why it's almost always paired with something like benzoyl peroxide, which the bacteria can't become resistant to. It's a really important 1-2 punch.
Now, for a lot of women, acne is very clearly hormonal. It often flares up along the jawline. For this, there's a whole other set of tools. Therapies like certain birth control pills or a medication called spironolactone. They don't just treat the pimple. They actually work by targeting the root hormonal driver, those androgens that kickstart the whole process in the first place.
So, your medical treatments are definitely the heavy lifters, but your daily habits? They're what create the supportive environment for those treatments to actually work. So, let's really quickly go over the absolute non-negotiables for your daily routine.
The name of the game is keep it simple, but be consistent. On the adopt list, you need a gentle cleanser, a non-ketogenic moisturizer, that just means it won't clog your pores, and sunscreen every single day. And just as important is what to avoid. Overwashing, which can just irritate your skin more, picking, which is the fast track to scarring, and using harsh, gritty scrubs that just cause way more inflammation.
So after all of this science, what's the one big idea we really want you to walk away with? It's a simple but super powerful mindset shift, and honestly, it changes everything about how you approach acne.
This right here. This is the key takeaway. Acne is a medical condition, not a hygiene problem. Let me say that again. It is a medical condition, not a hygiene problem. You cannot scrub it away. It's a complex process that involves hormones, genetics, and your immune system. And because of that, it requires a consistent, patient, science-based treatment plan, not just washing your face more aggressively.
You see, understanding the why behind your acne is what gives you the power to find the right what for your treatment. So the question we'll leave you with is this. Armed with this science, are you ready to move past the myths and start building a skincare strategy that actually works for you?